Everybody, it's Mara and it's Wednesday, so it's Sharing Wellness, Promoting Health Wednesday. And this month is RSD CRPS Awareness Month. So as they would say, we're going to color it orange. So this information is not intended to treat RSD. So if you have a question, consult your doctor. But we are going to talk a little bit about what RSD is, our nervous system, what its symptoms, causes are, why it's so difficult to diagnose, which you'll kind of figure out after we talk about the symptoms and causes, some treatment options, and some diet lifestyle tips. So CRPS RSD is complex regional pain syndrome. It's basically described as never-ending pain and inflammation. It's also known as the suicide disease. It usually follows an injury to an arm or a leg and can be both acute or chronic. It used to be known way back in the day when I got it in '94 as reflex sympathetic dystrophy or Calzasia, and it was renamed to complex regional pain syndrome. Its biggest symptom, of course, is pain, which fluctuates. However, one of its biggest signs is the pain's way out of proportion to the initial injury. You can also have some skin color changes, temperature, swelling in the extremity. For some people, it improves over time. For others, it's very relentless and can be disabling. They think that it's caused by actually an improper function of the peripheral C fiber nerve, which are the nerve fibers that carry pain messages to our brain. The excess firing also triggers inflammation, which is what our body uses to promote healing and rest after an injury. And in some people, there's an obvious nerve injury, and in other people, there's not. But either way, you still have it. Sometimes it's just a little bit more. So you can imagine if your body keeps signaling pain signals and creating inflammation, what's kind of going on. Historically, people were classified as having CRPS1 or CRPS2, and the difference was the nerve injury. Okay. CRPS1, they weren't really certain if there was a nerve injury or what nerve was injured. With CRPS2, they could actually identify a specific nerve injury, and most people with that had a little bit more extensive injuries. So since both types of CRPS have identical symptoms, both may be caused by a nerve injury, although nerve injuries in CRPS1 may go unnoticed, which is why they did those distinctions years ago. It's actually very more common in women, but it can occur in anyone at any age with a peak around 40. Most cases of it, they say, are mild and recover over months to a few years as the injured nerve hopefully regrows. But if that doesn't happen, again, we have symptoms that can linger and cause long-term disability. The outcome often depends not only the severity of the original injury, but also on an individual's underlying general health and nerve health. So the younger people, children and teenagers, tend to recover better than the adults. But adults with good circulation and nutrition recover better. So I'm going to give you a little overview of the nervous system. Our nervous system has two main parts: the central nervous system, which is basically our brain and spinal cord, and it consciously and subconsciously controls all the activities within the body. The peripheral nervous system, made up of the somatic and autonomic nervous system. The somatic nervous system works with our skeletal system and our senses, and it's responsible for the voluntary movements of our muscles. It's how we walk, sit, stand, frown, smile. The other system, and the somatic nervous system, communicates with the central nervous system. The autonomic nervous system is made up of two subsystems, the sympathetic and parasympathetic nervous system. And the autonomic nervous system is responsible for all the things our body does that we don't consciously control: digestion, breathing, blood flow, how our hearts beat, The sympathetic nervous system is responsible for handling emergencies. It's the fight or flight response of our body. It speeds things up. And the parasympathetic nervous system is responsible for rest and relaxation, slowing things down. So with RSD, we have the C fiber signaling pain, and we also have the sympathetic nervous system signaling to the body that something's happened and our fight or flight response is engaged. That's what makes it kind of complex, because if the sympathetic's overactive, then the other parts of the nervous system are going to be underactive or overactive. Needless to say, the system's out of whack. CRPS has many symptoms, but unprovoked or spontaneous pain that can be constant or fluctuate with activities is its main sign. Most people with CRPS RSD describe their pain as burning, pins and needles, or they affect, since it happens mostly to a limb, an arm or a leg, that it's being squeezed. And that I have a lot of pins and needles. I still have some of those, and I did feel squeezed. And if the nerves remain inflamed, then pain can spread up the leg or arm. And then sometimes the body mimics the pain in the opposite extremity. That's it mirrors the pain, so it redirects secondary involvement of the neurons to the opposite limb. So excess or prolonged pain after use or contact, changes in skin temperature. My leg got really cold, like an ice cube. From the knee down, it turned really red and purple. It swelled. The texture of the skin got kind of shiny and dry. There was some abnormal sweating and nail and hair growth. The joints were definitely stiff, especially my left hip. Wasting away or excess bone growth can also occur. And then you have impaired muscle strength and movement problems. So most CRPS is caused by damage or dysfunction of injuries against the peripheral sensory neurons, which then has secondary effects on the spinal cord and brain. So they say in more than 90% of the cases, it's triggered by nerve trauma or injury to the affected limb that damages the thinnest sensory and autonomic nerve fibers. And these small fibers, which lack insulating thick myelin sheets, are what transmit pain, itch, temperature sensations, and control the small blood vessels and health of all the surrounding cells. So all that occurs in the area that gets damaged by CRPS. So that's what kind of causes it. It can occur from a fracture, a surgery, a sprain, a strain, burns, cuts. If you break your leg and you immobilize it, that can create that situation of triggering the nerve. It's rare, but it does happen. I've heard of it happening and talked to people who said they got it from a needle stick or a cut. And in less than 1% of the people, there's actually no identifiable injury. The other thing that can cause it is poor circulation, because it impedes nerve and tissue healing. So when damage to the small fibers that control the blood flow cause the many symptoms of CRPS, the blood vessels in the affected area of the body, the limb, can dilate, causing fluid to leak to the surrounding tissue, causing red swollen skin. And this also will deprive the underlying muscle and deeper tissues of oxygen and nutrients, which can cause muscle weakness and joint pain. And when the blood vessels overconstrict and clamp down, that causes you to get cold or just a bluish color. That's why they think CRPS mostly develops in the limbs, because circulation's so constrained in our limbs. Our heart and circulatory system has to pump the blood down to our feet and hands and fight gravity to return it up. And when those nerve fibers are damaged, it slows that process. If you do have swelling, it's always good to keep those areas of the body elevated above your heart if you can. It's really important to exercise every day, even if it's only for a few minutes, because that keeps your circulation and oxygenation going. So you definitely, if you haven't consulted with a physical therapist, you want to. Compression stockings or sleeves limit the swelling, particularly when standing. I've had a compression hose on my left leg for 26 years now. Also, poor nerve health from other health conditions like diabetes or other nerve injury can impede the CRPS, make it worse. There's also some immune system involvement because the C fiber nerve cells communicate with the immune cells to help us heal from injury. And this excessive signaling can dysregulate these immune cells in the affected area. And many people with CRPS then have levels of inflammatory chemicals called cytokines that contribute to the redness, swelling, and warmth. And they say it's more common in individuals with other inflammatory and autoimmune diseases. So it's really important if you have CRPS RSD to focus on building health. There's actually no specific test, like there's no CRPS RSD test, but they do a detailed exam of the person by a neurologist, an orthopedic, who's very familiar with the patterns of the nerve sensories. Nerve conduction studies are also done. There's imaging by ultrasound, MRIs, and there's also triple phase bone scans where they use a dye, and that shows certain things about the resorption in the bone, which is indicating that there's a malfunction. So I actually had the detailed exam and the triple phase bone scan and an MRI. Treatment options. Here's the one thing that's really, really important with CRPS RSD. Early treatment's important. According to the National Institute of Health, which is where I got most of this information, by the way, is rehab and physical therapy is the single most important treatment for CRPS. Early diagnosis and physical therapy and rehab. Keeping the painful area of the body moving improves the blood circulation and blood flow and lessens the circulatory symptoms, while the individual can maintain flexibility and strength and function. It also doesn't reinforce the wrong signaling. When you move it, it reinforces the good signaling. Which is very helpful, and it would be occupational therapy, especially helpful for the arms. And then there's psychotherapy. We talked the other week on one of the lives about how chronic pain, anxiety, and depression are very closely interlinked. So identifying your feelings and going through those stages and seeking help from support groups and psychotherapy is very important to your recovery. There's also something a lot of people have heard of. It's called graded motor imagery. Some people with RSD CRPS has used it, and basically you use a mirror to visualize the painful body parts moving without actually moving them, and that actually seems to trigger the movement in the brain, and that's been very helpful for people. There's also medications from Tylenol to NSAIDs to neuropathic drugs like gabapentin. There's topical local ointments, sprays, or creams, lidocaine and patches a lot of people have used. Bisphosphonates that reduce bone changes in the body, similar to osteoporosis. Corticosteroids to treat inflammation, swelling, and edema. Some people have had botulinum toxin injections. A lot of people have done opiates. However, opiates can convey a heightened pain sensitivity and risk dependence. There's also NMDA receptor antagonists. There's spinal cord stimulation. There's spinal fluid drug pumps. There's also some alternative and holistic therapies behavior modification, medical marijuana, acupuncture, biofeedback, guided motion therapy, chiropractic treatment. The National Institute of Health doesn't feel that these actually treat the primary cause, but they do generally help with the symptoms. And then for the people that are really, really bad when everything else kind of hasn't worked, they look at ketamine injections. Former treatments that are really used today are sympathetic nerve blocks, because those are temporary, surgical sympathectomies, cutting the injured nerves, or actually amputating the painful limb. Those are rarely done anymore. Back in '94, that was kind of the standard of treatment. So if you want more information on RSD, I really suggest rsds.org. They have a Facebook page, and they have weekly informative meetings, and their website and blog are very informative. I get a lot of my information from them, Mayo Clinic and National Institute of Health. RSD, living a healthy lifestyle and making good dietary choices is really important when you have something as complex as RSD. And that's one of the main reasons that I think I did as well as I did, because I changed so many of my habits. Treating RSD is complex because it is complex. So you want to focus on building health, and by eating a nutrient-dense diet, eliminating sugar substitutes, food additives. Don't overdo caffeine if you can eliminate that. Eat whole foods that are not processed and don't come from a box or a package. And if you're really in bad shape, you really want to consider maybe eliminating gluten and dairy as well, to see if that's part of the inflammatory problem in the body. Basic supplements would be essential fatty acids, B-complex vitamins, vitamin D, and a multivitamin to support the body overall. Vitamin D has a lot for supporting bone health and immune system health, and B-complex and essential fatty acids really help support a healthy nervous system, and a multivitamin for all those trace minerals for overall health. When you look at the nervous systems affected, we have the enteric nervous system as well, and you want to focus on gut health, so maybe you want to add some probiotics or digestive enzymes. And there's a lot of supplements that can actually help with pain. B6, N-acetylcysteine, alpha-lipoic acid, magnesium. L-theanine can help with anxiety, and 5-HTP may help with pain and depression. You definitely also want to keep moving, and my God, I know it's hard in the beginning. If I could walk, my gosh, a block without puking, it was amazing. Drink lots of clean water, and make sure your colon stays rolling so your body's properly detoxifying. So like I said, the information tonight came from some webinars I saw from the RSDS website and the National Institute of Neurological Diseases and Health. And next week, I'm going to share a little bit more about what I did to improve my overall health and the Silky products that I used that I think really helped me. So thanks for watching, and remember that RSD's biggest symptom is pain is out of proportion to the injury. So if you know someone or someone in the family or the neighborhood stubs their toe and it's so bad that the pain is so excruciating they can't walk on it, that's like a big sign like something's definitely not right. So thanks for watching, and have a great week.